Okay, the government shutdown now the longest in U.S. history, and there's no signs of it ending anytime soon. President Trump calling on the Senate now to change the rules and pass the funding bill with just 50 votes instead of 60. So far, senators have resisted the change. Democrats are withholding their support from the funding bill as a way to get expiring health insurance subsidies extended. Policy experts say health care will get a lot more expensive without the subsidies.
In Utah, a 6-year-old who's making $63,000 would see their premiums increase 145% next year to about $1,300 per month. And that ends up in annual terms, end up being about a quarter of their yearly income without these enhanced tax credits would be them paying their premiums to receive health insurance on the marketplaces.
Yikes. Hundreds of thousands of Utahns use these health insurance subsidies, but there's a ripple effect that has the potential to affect everybody here in the States.
2 News' Liv Kelleher is live to explain more. Liv.
Yeah, Heidi, it's the potential pressure on the entire healthcare system that a former healthcare exec tells me concerns him most. If premiums become too expensive, people will drop their coverage, and that, he says, will drive more people to emergency rooms. The results could impact all of us.
People don't stop getting sick when they don't have health insurance. They just tend to hit the healthcare system, emergency rooms, doctors' offices when they are very, very sick.
This leading to stronger dependence on crisis care.
For the people who will lose coverage, who may turn to EDs for their primary care, is that a replacement for normal, regular care?
When people lose coverage and only get care through the emergency room, what happens is you miss the opportunity to manage the chronic conditions that are some of the most devastating ones.
2 News reached out to multiple hospital groups across the state to ask if they are prepared for an influx of uninsured patients. None of those groups responded and instead directed us to the Utah Hospital Association. The association sent us a statement saying this not only results in patients who are sicker and in need of more costly and intensive treatments, but it also contributes to longer emergency wait times for everyone.
I went to the hospital the other day and I waited 8 hours in the emergency room at the U of U.
John Edwards lives in Salt Lake and has experienced those longer wait times.
They were crowded, it's not their fault, but I get it. A lot of people are sick and they need a place to get health care.
But experts warn that as more uninsured patients flood the system, the cost will be passed on to employers and taxpayers.
It leads to less care, more crisis, more illness, and actually starts to increase the costs for all of us in health, all of our healthcare premiums and all of our healthcare costs.
Healthcare enrollment has been open for 5 days now. An Affordable Care Act policy analyst tells me that rates have more than doubled. The rates that you see now are locked in through next year, even if the government decides to extend these healthcare subsidies. If that extension happens, consumers will eventually see a rebate per ACA rules. Reporting live in Murray, Liv Kelleher, KUTV 2 News.